Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Coronary angioplasty. Introduction.
Sometimes people have serious problems with their hearts and the arteries that supply blood to them. When plaque builds up in the arteries of the heart, this is known as coronary artery disease.
Coronary artery disease can cause angina. It can also lead to a heart attack and even death.
Your healthcare provider may have performed an angiogram to look at the blood vessels of the heart and recommended an angioplasty. During an angioplasty, arteries that are too narrow for adequate blood flow are opened. If your healthcare provider recommends an angioplasty, the decision whether or not to have this procedure is also yours.
This program will help you understand better the benefits and risks of angioplasty. Anatomy. The heart is the most essential muscle in the body. Its main function is to pump the blood to the lungs and to the rest of the body. Since the heart is living tissue, it needs blood like the rest of the body. The heart also pumps blood to itself through many blood vessels that go directly to the heart muscles. These are known as coronary arteries. Symptoms and their causes.
Cholesterol and calcium deposits accumulate in the coronary arteries, forming a plaque that narrows the artery. Blood clots can also narrow or block the arteries.
Narrowed arteries do not let enough blood go through. This causes blood flow to decrease, which could cause heart attacks.
A normal blood vessel has a wide opening for blood to flow through. A blood vessel clogged with plaque is narrow, letting less blood flow through it. Blockages can cause chest pain, arm pain, or shortness of breath. If blood flow is reduced enough by cholesterol and calcium deposits, the heart will not be able to keep up with exertion. If the condition worsens, or the coronary arteries become blocked, the heart can be damaged.
Coronary artery disease first causes angina. Some patients with angina feel pressure, pain, or tightness in the chest, neck, arm, or jaw. If not treated, coronary artery disease can lead to a heart attack, which can be fatal. An angioplasty is a treatment used to open clogged arteries. After a successful angioplasty, blood flow in the blood vessels of the heart is improved. The heart receives the blood it needs, the symptoms are improved, and the risks of a heart attack are reduced.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments.
Angioplasty is one of several options for treating fatty buildup in the blood vessels of the heart. However, none of these treatment options is a cure. Fat can build up again in your blood vessels if preventive measures are not followed. Healthcare providers may prescribe drugs for people with coronary artery disease. Some medications can help make blood vessels a bit bigger or dilate them. Medications may also relieve symptoms and reduce the heart's demand for oxygen.
Another alternative is coronary bypass surgery. During this open heart surgery, a blood vessel from your body is used to create a detour around the blockage in the artery. Blood then flows to the heart, bypassing the clogged artery.
Your healthcare provider can discuss with you the treatment option that is recommended for you.
Procedure.
Your healthcare provider may ask you not to eat or drink for several hours before the procedure. If your procedure is in the morning, this usually means no food or drink after midnight the night before. Check with your healthcare provider for specific instructions. During an angioplasty, the healthcare provider first locates the narrowed artery, then opens it while the catheters are in place. There are several procedures for opening a clogged artery, which will be discussed next. Not all of them are appropriate for all patients. Your healthcare provider will determine the one appropriate for you. The angioplasty may be done on an outpatient basis, meaning you will be able to go home after the procedure is completed. Sometimes you will have to stay 1 or more days at the hospital. Based on your condition and other factors, your healthcare provider will explain the expected length of time you will stay at the hospital. This procedure is done while you are awake. Your healthcare provider may give you medication through an IV to help you relax. You will be asked to lie down on an X-ray table. The room may be slightly cold. During the procedure, your heart rate, blood pressure, and vital signs are continuously monitored. Let your healthcare provider know if you feel discomfort at any time during the procedure. Before the actual procedure, the hair around your wrist or groin area may be clipped and the skin disinfected. It is then made numb with a local anesthetic. This may cause some discomfort. A catheter is then inserted through the skin into an artery in the wrist or leg and threaded all the way up to the heart arteries. Whether the catheter is placed in your wrist or leg will depend on your healthcare provider's preference and the state of your arteries. You should not feel any discomfort. Dye is then injected into the arteries and X-rays are taken. You should stay very still during the X-rays to allow good, sharp pictures to be taken. Where blockage is found, the healthcare provider may open it using either a balloon or another device. The procedure that uses a balloon is called balloon angioplasty.
The balloon is attached at the end of the catheter and is threaded up to the area of the blockage through the artery used for the angiogram.
The balloon is then inflated and deflated a number of times to flatten the fatty buildup against the wall of the artery. This allows more blood to flow through it. You may feel some temporary discomfort during this step.
The balloon is then deflated and withdrawn.
Your healthcare provider may also use a stent. A stent is a small metal tube that helps keep a blood vessel in the heart open. It stays in your artery permanently. It may be coated with medication.
If a stent is used, it is attached at the end of the catheter and placed at the site. Sometimes a stent may also be used without a balloon to open a blocked artery.
Another way to open blocked arteries without angioplasty is a small mechanical device instead of a balloon that breaks the plaque into pieces. This procedure is called arthrectomy. The decision whether arthrectomy is suitable for you is made by your healthcare provider.
In addition to breaking up the plaque, a stent could be placed.
After the angiogram and the angioplasty, if it is needed, the catheter is taken out. After the catheter is removed from your groin, you will be instructed to lie flat and not bend your leg to prevent bleeding. If the catheter was placed in your wrist, you should not bend your wrist. A tight band may be placed around your wrist to ensure steady pressure for an hour or longer. You should not drive right after the procedure. Ask someone to drive you home. Ask your healthcare provider when you can drive again.
Risks and complications.
This procedure is safe. There are, however, several possible risks and complications. These are very unlikely, but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early.
The angioplasty may not succeed in relieving the blockage. Even if relieved, the blockage could happen again, or the stent could get moved out of position. This could lead to a heart attack.
If a stent is placed to prop the artery open, blood clots can form on the stent. Your healthcare provider will give you a blood thinner to prevent the formation of clots. The angioplasty could lead to a complete blockage, which would require urgent surgical intervention. Death is very unlikely, but remotely possible.
X-rays are used during this procedure. The amount of radiation during this test is deemed safe. However, the same amount could be dangerous for unborn children. It is therefore very important to make sure you are not pregnant prior to an elective radiological test. The angioplasty can rarely lead to a heart attack requiring an open heart surgery.
The catheter placed in the artery can rarely injure that artery or other arteries of the body. This may cause decreased blood flow to the leg or arm involved, which may require an operation to re-establish blood flow.
The insertion of the catheter can also cause injury to a nerve in the leg or arm depending on where the initial puncture was done.
Some people have allergies to the iodine dye used in this test. Make sure to tell your healthcare provider about your allergies, including seashell allergy, and about any possible reactions to any sort of dye used on you in the past. Your healthcare provider may prescribe medications to alleviate your allergy symptoms. In some people, dye can cause kidney failure. Let your healthcare provider know if you have a kidney problem. You might be at a somewhat higher risk. Kidney failure is more likely in patients taking glucophage, metformin, a diabetes medication. It is important that you inform your healthcare providers about all the medications you are taking.
After the angioplasty,
your healthcare providers will give you discharge instructions after the procedure. Bring a family member or friend to take notes. You may be sleepy and forget the instructions. Blood clots can collect around the stent after the procedure if you had one placed. To prevent blood clots, your healthcare provider may prescribe a blood thinner. Ask your healthcare provider how long you should take the medication. Do not stop taking the medication without first discussing the risks with your healthcare provider. Your healthcare provider will give you discharge instructions, which include a number to call in case of an emergency. Call this number if you have any new symptoms, such as fever, numbness or weakness, redness, swelling or bleeding at the puncture site. Infection after the procedure is rare. Fever, redness, pain, or swelling at the puncture site are common symptoms of infection. Call your healthcare provider immediately if you experience any of these symptoms. If you experience chest pain, you should go to a healthcare facility right away. You should also go to the nearest emergency room if you have difficulty breathing, arm pain, or an irregular heartbeat.
If your doctor places stents to prop the artery open, you may be asked to take a blood thinner to prevent clots from forming until the artery lining grows over the stent.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Coronary artery disease is a serious condition that may lead to heart attack and even death. Angioplasty is one treatment option that may open the narrowed artery and remove fatty buildups.
During the procedure, arteries that are too narrow for adequate blood flow due to a buildup of cholesterol deposits called plaque are opened. The healthcare provider inserts a catheter into an artery in the groin or wrist and threads it up to the coronary arteries. Where blockage is found, a balloon device at the end of the catheter may be used to flatten the fatty buildup against the wall of the artery. Following the angioplasty, your healthcare provider may decide to place a stainless steel mesh tube called a stent at the site of the blockage to keep it open. Your healthcare provider will likely prescribe a blood thinning medication to prevent a blood clot from forming on the stent.
Angioplasty does not prevent fatty substances from building up on the walls of the coronary artery. However, re-narrowing of the arteries can be prevented by eating right, exercising, quitting smoking, reducing stress, and controlling high blood pressure and cholesterol. Coronary angioplasties are very safe. Risks and complications are very rare. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.